friends, I'm Dr. Andrew Prue. Welcome to the second video of my series, How to Help an Addict or Alcoholic. In this video, we'll be discussing how to talk to and connect with a loved one in addiction. The information presented in this video is taken from my book, Understanding and Helping an Addict and Keeping Your Sanity, which is available from Amazon. If you're interested in taking a look, I've provided a link in the description below. All the information provided is evidence-based, supported by the latest research evidence, and is based on my experience as a doctor and addiction researcher and as an addict and alcoholic in recovery. I practice as a doctor in the ER, hospital, and office settings, and as a psychotherapist for 15 years. I went through a low-bottom addiction to opioid painkillers and alcohol, and I've been in recovery since September 2016. Since being in recovery, I went back to school to do my PhD in the Neuropsychology of addiction, and I've worked as a researcher, writer, and consultant on matters of substance addiction. If you'd like to know more about me, I've included a list of my credentials and a brief outline of my story in the description below. So good, let's get to it. I'll begin by making one thing clear. You are not and will not be your loved one's therapist. Not now and not ever, so please don't try to be. I'm not saying this to condescend or to say that you're not smart enough or lack the credentials to be a therapist for your loved one. Rather, it's because you're too close to them. When we're too close to another person, our ability to provide an objective opinion and advice is impaired by our history with that person. Even sponsors in the 12-step program don't sponsor people who are family members. In my own case, I currently have a family member who's having a terrible struggle with alcoholism, and he's at the point where he desperately wants to stop his drinking. Although I'm an experienced AA sponsor as well as a doctor and therapist, I'm too close to him for me to even attempt to be his sponsor or therapist. Rather, I've taken him to AA meetings, and I've introduced him to people who can help him, and I've given him the phone number to connect with qualified addictions professionals in our area. I let the professionals help him. I serve only to support him and to steer him to the right resources. And that's a role that family members and other loved ones should take on when they want to help an addict loved one. So our role as family members and friends when we want to help an addict loved one includes some very important functions. Ensuring that our loved one knows that there's effective help available whenever they're ready to accept it, and that we can put them in touch with the right people who can help them. Being approachable, which means that we don't place ourselves in a position of conflict or nagging, and that we demonstrate a knowledge of addiction and a willingness to listen and learn. Making our loved one aware that we understand that addiction doesn't define them, and that we hate the disease but love the person. Providing accurate information when asked. Setting boundaries, employing loving detachment, avoiding becoming an enabler, and being tough and firm when the loved one attempts to manipulate us. By the way, all this information about setting boundaries and employing loving detachment and avoiding becoming an enabler is covered in upcoming videos in this series. Ceasing to participate in the chaos, which means we stop being part of the addiction. And engaging in self-care so that we are happy, healthy, and whole. We can't help anyone when we're a nervous wreck participating in chaos. So let's talk about some of the things that I suggest you don't do when trying to help an addict loved one. Don't lecture, threaten, preach, moralize, or make emotional appeals to addicts about their substance use. They're already very well aware that what they're doing isn't right, and they're already racked with guilt about it, even if their pride won't allow them to show it. In fact, one of the driving factors of addiction is people trying to drown their guilt in alcohol or drugs. So increasing the guilt further propels substance use and drives a pointless wedge between you and the addict. Your lecturing isn't going to make them stop. Don't try to deal with them while they're intoxicated. Don't hand over control of conversations to an addict. It will inevitably turn into a non-productive argument that you cannot win. Arguing with an addicted mind is an exercise in futility. Don't lie, make excuses, or cover for the addict's behavior, or otherwise try to protect them from the consequences of their substance use. Don't take over an addict's responsibilities, except when absolutely necessary, such as caring for the addict's children when the addict cannot safely do so. Don't give an addict money, no matter what they say it's for. Don't feel guilty or responsible for an addict's substance use and behavior. Addicts are master manipulators, and guilt is their favorite manipulation tool. Avoiding feelings of guilt may be easier said than done, and we'll discuss it further in this video. Don't surrender control of your happiness and peace of mind to an addict. Again, this is easier said than done, but we'll nail down exactly how to do this in this video series. Helping an addict begins with stopping the fighting, and this is also the first step in extricating yourself from the chaos of the addict's life to regain your sanity. The relationship between an individual in active addiction and family members is almost always adversarial. Both sides are involved in creating this relationship. The addict shirks responsibility, does terrible selfish things, lies and deceives, and becomes defensive and aggressive every time they're confronted. Money is wasted, opportunities are lost, there may be trouble with the law, and the obsession with substance use is incomprehensible to the average person. Naturally, the addict's loved ones are offended and frustrated and react with anger, and that's how anybody reacts when someone else's behavior is unacceptable. Angry confrontations with an addict are counterproductive to helping a loved one find their way out of addiction, and it's counterproductive to your happiness and peace of mind. I suggest that people take a different approach when dealing with an addict loved one. I suggest taking the high road and letting go of the natural angry response to the symptoms of addiction. This doesn't mean letting your loved one off the hook for all the destruction and crappy behaviors. Not at all. Part of the healing process in addiction treatment and in recovery involves owning up for past behaviors and making amends to those who were harmed. However, in the meantime, chastising someone in active addiction is unlikely to result in any such contrition and restitution. Rather, it just serves to get a defensive and angry response from the addict and creates an angry barrier between you and your loved one. There's no point in lecturing addicts about all the damage they're causing and how they're ruining their life and their health, how they can die from their addiction, and how they're hurting other people. They already know all that. It weighs very heavily on them. If you believe that presenting enough evidence of the harms of addiction will make an addict stop their substance use, then think again. All you accomplish is to drive the addict further away from you. When we lash out at or scold an addict loved one, we're showing them that we don't understand what they're going through. They come to see that we don't understand at all the obsessions and compulsions that are driving their behavior, so they come to see us as naggers and therefore unapproachable. After all, why talk to someone about your problem if they don't understand it at all, or if they'll just nag you about it? Nobody wants to come clean and lay their heart out in front of someone who will be judgmental and critical. Besides, think back to all the confrontations you've had with the addict in your life. How did you feel afterwards? Did it feel like your heart rate and blood pressure were elevated for a while? Were you upset for hours? Did it perhaps ruin your day? Did it affect how you interacted with other people the rest of the day? Did it affect your sleep that night? Were you flooded with negative emotions such as anger, regret, anxiety, and frustration? And did these emotions stick with you for a while? Sometimes it's worth a little battle if we solve a problem. But did anything get solved with your battles? Was it worth it? Just because we seek a non-adversarial relationship with an addict doesn't mean we turn a blind eye to the terrible things they do. Rather, we should stay firm but keep confrontations from degenerating into an angry exchange. Now let's go through some tips for how to do that. It may take some practice because addicts are not easy to deal with. Choose your battles. Don't waste a confrontation on every bit of lousy behavior, just the ones where there's a specific message and a point to it. For example, one super common confrontation is when a family member finds an addict's stash of drugs or alcohol. The family member will freak out, Confront the addict angrily and make a show of flushing the drugs or pouring out the alcohol. Naturally, the addict freaks out in kind. That's an example of a pointless confrontation. You're only proving that you outsmarted your loved one and that the substance use is wrong. It's a hollow victory. So what? Even if your loved one denies substance use, simply letting them know that they're not fooling anyone is enough to make your point, which should be done with or without finding a stash. Sure, if you find a stash, destroy it. But is there a point to turning it into a big confrontation? I suggest avoiding an argument about it and saying something firm and with a point, such as, "If you bring drugs or alcohol into this house, it will be destroyed. It puts all of us at risk." So there, you've made your point. Now you end the conversation. Walk away from it if you have to. But just don't get drawn into a pointless emotional back and forth. So let's look at an example of a worthwhile confrontation with a point. Let's say you find out that your addict loved one took $50 from your wallet to buy drugs. A confrontation on the matter is worthwhile because it allows you to set boundaries and make a point that matters. For example, you could say, "I know that you took $50 from my wallet, and I know you used it to buy drugs. In the future, we'll make sure that no one leaves money lying around the house since your behavior has come to this. I will be keeping track of the money you took because you will pay me back one day." In this case, you made your point. Now end the conversation and don't let it degenerate into a pointless, bitter argument of denials and vitriol. The scenario just described is also a perfect opportunity to let your loved one know that you understand what they're going through. For example, consider adding, "I know that you took the money because you're desperate for drugs. I believe you're addicted, and I know that people are driven to desperation by addiction." If the individual denies drug use at this point, just continue with your statement. "I want you to know that I understand that you're not a bad person, but that you need help. I have some information about how to get help, and I want you to know that everybody is capable of beating addiction. If you ever decide that you've had enough, I can put you in touch with the right people." So this is a confrontation that had a point. You established a boundary that theft will not be tolerated. You establish accountability. You will pay me back one day. And you showed the addict that you understand and are approachable. Allowing the confrontation to degenerate into an argument or emotional exchange or denials will destroy your point, and your point will be forgotten. Avoid emotional outbursts. It takes practice to avoid being withdrawn into an emotional exchange, especially over such an emotional issue as watching a loved one destroy their life and seemingly doing their level best to destroy yours at the same time. You can expect the addict to respond to your confrontations with emotions, defensiveness, and perhaps even aggression. However, you must be the one to keep your emotions in check, to avoid responding to emotion with emotion, and to end the confrontation when your point is made, before the encounter degenerates. Control the conversation. Confrontations degenerate when you lose control of them. The addict may try to draw you into a fight, but you must be the one to make sure you don't allow yourself to get sucked in. Do your best to make your point and then get out. If you can't make your point, end the conversation and try again at a more opportune time. Never make a threat you don't intend to keep. Addicts are master manipulators. It's part of their disease. They seek out enablers so that they can manipulate, and those who care about them are the ripest targets. If you threaten a sanction and you don't follow through on it, the addict will know you're malleable and easily manipulated. I suggest that you carefully consider each boundary and consequence, exactly when they'll apply, and how you'll apply them before you communicate them to the addict. Now isn't the time for empty threats. Manipulators can smell empty threats from a mile away, and addicts are expert manipulators. We'll talk more about setting and enforcing boundaries in an upcoming video in this series. By ending the unwinnable arguments and battles, it becomes possible to begin breaking down the barrier between you and the addict. The goal here is to get to a point where the addict feels comfortable reaching out to you and talking to you about their struggles. This requires the addict being 100% certain that sharing and coming clean with you will not result in an emotional eruption. I suggest you make it known that you've learned about addiction, but you want to listen and learn more, that you aren't going to be judgmental, and that you can respect confidentiality, and that you're not going to be punitive. The disease model of addiction helps us to separate the sickness from the person. It's important to remember that you're dealing with an unwell person who's showing symptoms of a sickness. Hate the disease, but try to remain compassionate for the person. If you'd like to know why I'm calling addiction a disease, please check out my video, Why They Call Addiction a Disease. The link to the video is in the description below. Remember, people aren't usually very far along in their addiction when they reach the point where their substance use is no longer fun, and they do anything to stop. The addict's pride, their arrogant know-it-all attitude, and the constant conflict with you may keep them from letting on. But don't kid yourself, they're hurting inside. They're miserable, and they don't like who they've become any more than you do. They aren't choosing substance use over you, or their job, or their kids. They've long ago passed the point where their substance use is a choice. Otherwise, they'd just stop. So, a little exercise in reflecting on what it's like to be the addict goes a long way to helping us to be patient, tolerant, and compassionate when dealing with them, and to leave our anger and frustration out of it. It's best to walk away when that becomes difficult. Calm down and try again later. As soon as our emotions take over, we're no longer in control of the interaction. Showing compassion for someone doesn't mean that we let them walk all over us. We can and should still set and enforce boundaries, maintain control of interactions, and be firm in our resolve. Showing compassion means that regardless of the nature of our interaction, even if we're kicking the addict out of the house, we do so with respect, with fairness, and without allowing emotions to drive our speech or actions. Compassion is about separating the sickness from the person, even during moments of tough love. In order to be part of the solution to your loved one's addiction, there are certain messages that I suggest that you get across. The best way to do this is to make sure that you repeatedly include certain bits of information in all your serious interactions, so that your loved one hears the message over and over, and the message penetrates that inward-focused addict brain. These messages serve three purposes. They help reduce conflict, they put positive ideas in the addict's head, and they tell the addict that you know what you're talking about. When your loved one processes these messages, you'll ruin their substance use for them, because these messages will resonate in their mind every time they drink or use. Their substance use will never be the same again. They'll always be thinking about your message, and they may begin believing there's a way out. They may begin ruminating on the possibility of life after addiction. When we get these messages across, addicts begin to see that we understand, or at least we're trying to understand, their experience, and they see that we're not judgmental and condemning. It lays the foundation for the addict to see us as a resource to reach out to when they become ready to talk and at least consider accepting help. Here are the messages that I suggest you make sure you get across to your loved one. It's okay to acknowledge your addiction. In the first video of this series, I talked about how denial is a cardinal symptom of addiction, and I discussed why the addicted brain and mind generate this denial. The addicted mind is fixated on denial and running away from problems. Nobody can deal with or even discuss a problem that they don't believe or won't admit they have. So to get anywhere, addicts must acknowledge their addiction. The very first of the 12 steps is admitting that there's a problem. However, it's important not to try to force this on the addict. It can be hard for someone to admit that they have an addiction, even though it's obvious to everyone around them. You can be a huge part of the addict's acceptance process simply by providing a safe, non-judgmental, and understanding venue for them to begin discussing that there's a problem. I suggest that you don't demand this acknowledgement of the problem, trying to force the acceptance of the problem by shoving the facts in an addict's face creates barriers and doesn't help the problem at all. I suggest simply communicating to your loved one the reasons that you believe they have a problem with substance use. You can describe the symptomatology that we discussed in the first video of the series, and that it's okay to admit there's a problem. Then walk away. Let it sink in. Don't push. Don't allow it to turn into a debate. The addicted mind is racked with fear, and the greatest fear is that someone will interfere with their substance use. And that'll keep them from coming clean about their addiction. If they think that you're going to take them by the ear and run them down to the hospital or force them into rehab or call the police, they're not going to talk to you about anything. So I suggest making it known that you are a safe resource to talk to. Those ambush-style interventions make for great television, but they don't make for great recovery. You are an unwell person who needs to get well, not a bad person who needs to become good. Just as we need to separate the disease from the person, so too does the addict. This may be the single most effective message for transitioning the addict from seeing you as an authoritarian nagger to seeing you as someone who's safe to share their struggles with. Once the arguments and battles have stopped and you've stepped outside the addict's circle of chaos, this message positions you as an objective, open-minded source for support. Every person is capable of a full and permanent recovery from addiction. Most people in active addiction feel like recovery is way out of reach for them. Their self-confidence is understandably low after multiple failed attempts to control or stop their substance use. Getting through detoxification is especially daunting for them. Even though it only constitutes a week or so of their life, they're terrified of it, and many doubt their ability to get through it. This lack of belief in their ability to beat addiction is a serious barrier to recovery. The turning point in my addiction was where I finally came to believe that recovery was possible. I'm angry at drugs and alcohol and addiction, not at you. Although you may be really, really angry with your addict loved one, I'm hoping I can talk you into directing your anger more at the addiction and less at the person. If you want to show your loved one that you understand what they're going through and why, and you want your loved one to see you as approachable and understanding, then I suggest you communicate that addiction does not define them. You are worthy of recovery, and you deserve to be happy and healthy. This shows that your love is unconditional, even if you've had to resort to some tough love. Addicts are disappointed in themselves, and they tend to beat themselves up mercilessly. Even if they put forward an outward appearance of arrogance and self-righteousness, deep inside, addicts are down on themselves. Many believe that they aren't even worthy of recovery or deserving of a happy life, and this presents yet another barrier to recovery. I'm not going to be your enabler. Although your love may be unconditional, you should avoid the pitfall of allowing an addict to leverage your love to help them with their substance use. Enabling is a form of accommodation that makes it easier for the addict to obtain and use drugs or alcohol, protects them from the consequences of their substance use, or helps them to avoid facing up to their problems and getting help. By being an enabler, you're participating in the addiction, even though you're trying to help with the best of intentions. Sadly, my experience has been that most families and friends don't fully realize when they've been drawn into enabling an addict. Addicts are master manipulators, and they naturally gravitate to people they can exploit. Their usual focus is on obtaining money or something they can sell or trade for drugs or alcohol. Those who love them most are the prime targets because the addict can leverage their love and desperation to help. Addicts will make emotional appeals for money with the saddest of stories to back up their demands, often accompanied by tears and promises to stop drinking or using. They know your soft spots, and they know what you want to hear. We'll talk in depth about how to cease being an enabler in an upcoming video. In the meantime, getting the message across that enabling will stop and that you won't be manipulated helps remove you from the addict circle of chaos and helps you to stop participating in the addiction. By the time you finish this video series or read my book, you'll be an expert non-enabler. So if your loved one makes emotional appeals for money for food or rent or medical bills or whatever, know that the money will almost certainly go entirely to substance use. It doesn't matter what the money's intended for. When an addict gets a hold of money, it will go to substance use. Addiction is a disease of the here and now, and consequences don't matter when it comes to getting that drug or drink. To addicts, getting evicted in a few weeks is a problem they can worry about when it happens, so getting the drug or drink now is all that matters. If you recall from my first video, this happens because the part of the brain that's responsible for thinking, planning, and evaluating consequences, that's the prefrontal cortex, is rendered virtually inert by addictive substances. When it comes to tough love, you must be firm, even in the face of heartbreaking emotional appeals and attempts to make you feel guilty. You must be consistent. You must make sure that the rest of the family is on board and firm and consistent as well, or the addict will pick on the weakest member of the family. When you set boundaries and rules, you must stick by them, no matter how tough it may be. If you give a little, you'll be pushed twice as hard. Remember, this isn't about punishing the addict. It's about not being an enabler. I'm willing to support you in your recovery. By support, we're not talking about financial support, unless that's something you choose to do. A major barrier to addicts becoming ready to seek and accept help is that they usually feel overwhelmed by life. During their addiction, they may have gotten into trouble with work, school, family, and the law. They've avoided and run away from their problems and have burned bridges. Many even say they don't want to get sober because their life would suck too much. When people feel overwhelmed, it's immensely helpful for them to know that someone's in their corner no matter what. Letting an addict know that you'll be there to provide love and encouragement as they clear up the wreckage of their addiction does much to break down fear as a barrier to recovery. To them, life is a scary and threatening place where bad things happen to them. Knowing that they won't have to face life alone is immensely reassuring to them. There is life after recovery. People in active addiction believe their situation is an impossible quagmire, that their life is too messed up to be fixed. However, I've seen countless times that remarkable comebacks are the norm. By reassuring an addict that you have information that addicts are able to thrive again in recovery, no matter how much chaos their life is in right now, you're providing a point of focus for finding the motivation they need to commit to recovery. They'll begin thinking about what you said, and they'll begin finding reasons that recovery is worth the effort. In this video, we talked about communicating with an addict in such a way as to stop being drawn into their circle of chaos and participating in the addiction. We also talked about communicating with the addict in such a way as to set the conditions for them to start moving toward readiness to finally take a leap of faith and accept the hand of help. In my next video, we'll discuss the mental process that occurs as addicts move from denial and refusal of help to readiness to admit to their problem, let go of their need for control, and commit to treatment and recovery. Family and friends are in the very best place to help and even guide addicts along this mental process, and I'll provide tips for how you can help this process along. This is one area where you can have the greatest impact on your addict loved one's future. If you'd like to know more about what we discuss in this video, please check out my book, Understanding and Helping an Addict and Keeping Your Sanity, available on Amazon and other booksellers. If you're interested, I've provided a link in the description below. Thanks for watching. Please hit the like button if you found this video useful. I provided links to my other videos in the description below. Please subscribe and click the bell to be notified as further videos in the series become available.